Mucormycosis is a type of fungal infection that is also known as Zygomycosis, and sometimes it may be referred to as black fungus, and it is caused by spores that are found in the environment, in the air, soil, fallen leaves, compost, and on mouldy bread. Mucormycosis may be caused by a number of species including Mucor, Rhizopus, Absidia, etc. And these fungi are harmless to healthy individuals. Presenting features of mucormycosis infection include fever, coughing up blood, confusion and headache, seizures, non-healing wounds, and bulging eyes with black tears. There are a number of risk factors for developing mucormycosis, and these include immunosuppression, for example, patients who have had organ transplants, a low neutrophil count or neutropenia. Neutrophils are a type of scavenger white cell. People on corticosteroids, poorly controlled diabetes is an important risk factor, skin injuries such as burns and trauma, and more recently severe COVID-19 infection. And mucormycosis as a result of this has been a particular problem in India. Inhalation of airborne spores is a major route of infection of mucormycosis. Other routes of infection include cutaneous via wounds and burns, and less frequently ingestion of mucormycosis spores into the gastrointestinal tract. In mucormycosis, the hyphae have an irregular width varying from 6 to 50 microns across. They tend to branch at right angles, and as with any fungus, they can be demonstrated with fungal stains. The main sites of infection in mucormycosis include the nasal sinuses, the orbits, lungs, gastrointestinal tract, and the brain. Complications of mucormycosis include spread of the fungus from the nasal sinuses to the orbit and brain, particularly in diabetics, and this may cause meningoencephalitis, where the coverings of the brain and the brain itself become infected, and this can lead to cavernous sinus thrombosis. Other complications include osteomyelitis and necrotizing fasciitis. Necrotizing fasciitis is sometimes called the flesh-eating killer bug. Lung involvement may be secondary to rhinocerebral mucormycosis, or it can occur as a primary infection, particularly in immunocompromised patients, such as those with hematological malignancies. Lung involvement can cause hemorrhagic pneumonia. The fungi invade the blood vessel walls, causing thrombi to occur with infarcts. Treatment of mucormycosis is with antifungal antibiotics, especially amphotericin B. Surgery may be necessary to excise dead and infected tissue. The mortality is around 50%, and disseminated mucormycosis is almost universally fatal. This is mucormycosis causing necrosis of subcutaneous tissue. This is a section of lung stained with a silver stain for fungi. The background is stained with a pale green counter stain, and the fungal hyphae are stained black. This is a blood vessel containing a blood clot. Within the clot are numerous fungal hyphae, and you can also see hyphae invading the wall of the blood vessel. This is an H&E section of a piece of lung. At the top of the picture is a blood vessel, and at the bottom of the picture is hemorrhage as a result of hemorrhagic pneumonia. This is mucormycosis in the brain, and you can see the right-angled branching of the hyphae of the fungus causing mucormycosis.